So let me put you on the know that you are being assessed. So that assessment includes keeping to time. So your presentation is for 5 minutes only. Go to the striking point. Thereafter, you have 1 minute to question in case anybody has a question or thereabout to ask. So let's put our hands together as the first presenter takes the stage. You are the one that needs a microphone, it's true.
Okay, good afternoon, moderators. Good afternoon, ladies and gentlemen. My name is Glory Philemon Baby, and I'm presenting on the topic hand hygiene and the hand-mind connection, assessing practices and bacterial contamination among secondary school students. So from today's topic, we're talking about wellness. And then from my topic, hand hygiene is also connected to wellness, because if you have a good physical well-being, invariably you have a mental well-being. Then this takes me to the next slide, statements of the problem. We know that contaminated hands are one of the most common modes of transmission of microorganisms responsible for infections in healthcare, food industry, and public places. And then we know that we're in the post-COVID era, and then we are still talking about the COVID-19. This in turn shows that hand hygiene practices and the associated knowledge are critical measures to control the spread of infectious agents. And knowledge of hygiene practices and hand contamination with infectious agents will facilitate risk assessment for predicting potential disease outbreaks. The aim of the study was to assess hand hygiene practices and bacterial contamination of hands among secondary school students in Calabar. And the specific objective included the determination and prevalence of hand contamination with bacterial organisms among study students, and also to assess the knowledge and level of hand hygiene practice among the subjects. It was a cross-sectional study, and it took place in a secondary school in Calabar. Ethical consideration was obtained, and then questionnaires were distributed to study participants. The sample size here was 384, but due to lack of funding, it was actually reduced to 100. Materials and method. It was simple. Sterile swab stick was used to emulsify. It was emulsified and used to swab palms of students after break. We did this years after the long break. Then following bacteriological processes, it was cultured on two media, blood agar, and then McConkey. Okay. Incubated, and then after 24 hours, colonies were read and other biochemical tests were carried out on it. Statistical analysis were also obtained on it. Then results. Out of the 100 students that participated, all hands had 1 or 2 bacterial contamination. As we said, so for both male and females, they were contaminated. Age group, according to classroom, there was no statistical significance because they were almost the same number. Then distribution of isolated bacteria on hands. Okay, so for some participants, we recorded Staphylococcus aureus alone, about 7%. Coagulase negative staphylococci alone, which amounted to 52% and was like the highest prevalence in this study. E. coli alone, 4%. Klebsiella species, 3%. Bacillus species, 5%. And then we recorded the fact that one or more organisms were present on some participants' hands. And these included Staphylococcus aureus and coagulase negative staphylococci, which was the highest, about 12%. Then now we talked about the knowledge of each participant. From this table, it is shown that students had good knowledge of what hand hygiene is all about. Because there was a question here that asked, how often? Okay, this has to do with the level of hand hygiene. Sorry, please. The level of hand hygiene. And here, there were statistical significance of some questions that were asked. For example, how often do you wash your hands daily? Many of them wash their hands less than 5 times in a day. Okay, so when do you usually wash your hands? And then some said before eating, some said after toileting, after playing, after coughing. Some did not even wash their hands after those exercises. Then I move further to the next slide, which says the knowledge. When we asked about the knowledge of hand hygiene, it was obvious that many students knew what hand hygiene was, but unfortunately, they did not stick to hand hygiene practices, because it is from my slide, it said, do you believe dirty hands can spread diseases? And many of them said, yes, they do. And it was statistically significant. Discussion. The study recorded an overall prevalence of 100%, okay, which aligns with the range of 93 and 95% findings from Jamie Kalaje in Delta State and Kenneth. And then showed that this student had an overall contamination of 93 and 95% of contamination, respectively. But however, it was markedly higher than that reported in India, which had a prevalence of 64%. And from our studies, it was seen that we had 6 genera of microorganisms isolated. The subject demonstrated fair knowledge regarding awareness of bacterial contamination, as seen that 80% were aware. And it was also in tandem with Gawa and Danjan, who had 81 and 69% of awareness of, that's a good knowledge of hand hygiene. But findings from my work also demonstrated lack of hand washing materials, limited the respondents' hand washing practices, as 75% of respondents cited a lack of hand washing material. This is in tandem with Otto et al. 2022 from Southwest, who also said that students from that secondary school in Ekiti State also had inadequate hand hygiene supplies as the reason why students failed to wash their hands. Conclusion. The study found an absolute level of bacterial hand contamination among the study participants, with potential for infectious disease transmission in the students' population. Students showed good knowledge of best hand hygiene practices, but inability to conform with such practices due to lack of hand hygiene supplies. Provision of adequate hand hygiene materials in schools for student use would likely enhance good hygiene practices and contribute to reduction in the transmission of infectious diseases in the student population. These are my references, and thank you very much for listening.
Okay, we are told we have 12 presentations to do in this sitting. So what we intend, 5 minutes. And then we can do questions. We won't ask questions after each one. So we do the first 6. After that, we take 2 questions for each person. Then we do the last 6. So you can stay at the high table so that you don't move up and down. So the list of where's Dr. Professor Atanwo? List of presenters. You are the second? Okay, take the stage. Take the stage. The 5 minutes. We warn you when it is 4 minutes, and then you have to stop when it is exactly 5 minutes. Thank you. We warn by, all right? Maybe when it is warning, you say. Then when it is time up, the person can come back.
Hello, good afternoon, distinguished ladies and gentlemen. I am Dr. Udekaite Sunday, Department of Pharmacology. I'm here to present on the paper Restoring Metabolic and Mental Health, Therapeutic Potentials of Cautery Solitarius in a Polycystic Ovarian Syndrome. These are my contents and a brief background on the introduction. So Polycystic Ovarian Syndrome, known as PCOS, is a metabolic endocrine disorder that arises due to hyperinsulinemia and leads to hyperandrogenism that worsens the follicular development. And this is common with women of reproductive ages and has been linked to a depressive state. Because of that, decline in productivity. Of late, we've been having a higher incidence of polycystic ovarian syndrome. The picture is depicting a normal ovary against a polycystic ovary. For the statement of the problem, we hope to address 3 major gaps. One, the scientific gap of oxidative stress pathology in polycystic ovarian syndrome, the need for alternatives, and also the use of computational model to postulate molecular mechanisms of these alternatives on PCOS pathology. For the aim and objectives, we hope we investigated the ameliorative effect of Cautery solitarius and try to explore on the metabolic potential. For the materials and method, the study was in 2 phases. We had an in vivo and an in silico. For the in vivo, the condition was simulated in animal studies for 14 days using letrozole and treated for 21 days. And we had 6 groups. For the in vivo, the parameters assessed were hormonal assays, lipid profile, blood glucose, and ovarian histology. For the in silico, we characterized the phytoconstituents in 4 extractive medium using GCMS. Above are the settings of the GCMS. Then for the in silico docking, we made use of advanced molecular docking tools, Pyrex, Pymo, and the rest of them. And we conducted the post hoc in silico study validation using Schrodinger Maestro. And then we did molecular dynamics on a key lead compound. And the parameters of interest were anti-androgenic, anti-inflammatory, and antioxidative properties of C. olitorius. These are some of the results I have for the hormonal profiling overview. For the lipid profile, we will notice that in PCOS state, we have dyslipidemia, whereby LDL, VLDL were elevated. And for the treatments, there were significant declines in them over time in about 5 weeks. For the blood glucose level, and for the treatment, after 5 weeks of treatment, there were declines in them. For the histology finding, for the histomorphometry, we noticed that in the PCOS subsection B, we had cystic follicles, that's follicles without viable ova. Then for the treatment, we noticed decreases in these cystic follicles and emergencies of mature Graafian follicle and secondary Graafian follicles in them. As a result of that, in the in silico study, we characterized the phytoconstituents. Then we had 22 phytoconstituents, in which 15 passed the sweet asthma and protox testing. That's the pharmacokinetics needed to make a compound a druggable candidate. And then we did analysis of our bioactives of C. olitorius against standard drugs. We did a comparative analysis in which camphorous, stigmasterol, even better than the standard drugs in the market. As a result, polycystic ovarian syndrome, and this will lead to better metabolic recovery and improved mental health state of mind for such females. As a result of this, their economic productivity will definitely be better. And in a low-income economy like Nigeria, this will be very, very obtainable. In conclusion, C. olitorius is... Thank you. Okay, in conclusion, C. olitorius shows promise as a druggable compound. And these are my references. Thank you.
Take your seat. Okay, may we have the third presenter? Please, when you're coming to do your presentation, let's know more about you. Are you a graduate student? Are you a lecturer? Are you undergraduate? Let's know more. The third presenter is Orok Daniel Achibong.
Good afternoon, my prof. Good afternoon, ladies and gentlemen. I am Orok Daniel Achibong. I'll be presenting on the pattern of hemoglobinopathies among first-year students in College of Health Technology, Calabar, Cross River State. Next slide. Okay, these are my contents, the content of my presentation. Next slide. Hemoglobinopathies are inherited disorders of hemoglobin molecules, often resulting from structural abnormalities of globin chains or reduced production of globin chains. And when these structural abnormalities of globin chains occur, it leads to the substitution of glutamic acid by valine, leading to the formation of abnormal hemoglobin S, or the substitution of glutamic acid by lysine, leading to the production of abnormal hemoglobin C. In Nigeria, the prevalence of sickle cell carrier has been reported to be about 20 to 30%, while the disease state has been reported to be about 2 to 3%. Given the high frequency and the potential burden of this disease, early identification of this hemoglobin genotype among young adults, such as first-year students, is important for health awareness, counseling, and preventive measures. Next slide. Next slide. Okay, statement of the problem. Despite the documented overall prevalence of hemoglobinopathies in Nigeria and in Cross River State, many individuals, including young adults, commencing tertiary institutions may not know their hemoglobin genotype status. In the majority of cases, the hemoglobin genotype testing is done when medical care is being sought or as part of school entry during medical examination. Thus, there is need to review the existing screening record among first-year students in College of Health Technology. Next slide. Aims and objective. The aim of my work is to determine the pattern of hemoglobinopathies among first-year students in College of Health Technology, while my objectives is 1, to determine the prevalence of different hemoglobin phenotypes, 2, to assess the association between hemoglobin phenotype and gender, 3, to determine the prevalence of clinical significant hemoglobinopathies in the study. Next slide. My study area was College of Health Technology. My study design was a retrospective study design, thereby reviewing the hemoglobin genotype screening records of first-year students from 2020 to 2022. My study population comprises of all first-year students in College of Health Technology. The sample analysis method that I used was cellulose acetate electrophoresis at alkaline pH 8.6. Next slide. My ethical consideration was sought from College of Health Research Ethics Committee. Then my data analysis was, the data was summarized using percentage, while chi-square was used to assess the association between genotype and gender. Next slide. In this, my table 1 shows the prevalence of different hemoglobin phenotype among first-year students from 2020 to 2022. This table shows that the overall prevalence of genotype AA was 77.8%, AS was 21.7%, SS was 0.48%, SC and AC was nil. Next slide. Table 2 shows the gender distribution of hemoglobin variants among first-year students. In this table, the overall genotype AA in male was 11.0, in female was 66.8. In AS in male was 3.1, while female was 18.6. The SS was 0.16 in male and 0.32 in female, while AC and AC was nil. Next slide. This table shows the association between gender and hemoglobin phenotype. In this association, there was no significant association between gender and hemoglobin phenotype. Next slide. Table 3 shows the prevalence of clinically significant hemoglobinopathies, and in this table, the prevalence was 0.48%. Next slide. Discussion. Now, the prevalence of hemoglobin AA and AS in this study was inconsistent with other studies, which gives 70 to 75% in AA and 20 to 25% in AS. While the hemoglobin AS prevalence was much lower when compared to other studies, which gives 2 to 3%. And this was a result of what? The lower numbers of individuals with sickle cell disease. Now, in AC and AC, what I got was the prevalence was extremely rare. Okay. Conclusion. So in the conclusion of my work, it shows that it shows a relative low prevalence of hemoglobinopathy such as sickle cell disease among first-year students in College of Health Technology. However, mass literacy campaign and improved genotype counseling and testing should be encouraged and maintained in tertiary institutions in order to eradicate hemoglobinopathies. Thank you.
Thank you very much. We go on to the fourth presenter. Kate, is it Ucho or what?
Good afternoon, my professors, other co-participant present. I'm Dr. Wis Nachuoman, PhD, Chief Lecturer, Cross State College of Health Technology, Alpha. We'll be talking on the biochemical evaluation of the potency of antiretroviral combination therapy among HIV patients. Who is controlling? Next slide, fast, fast. Human immunodeficiency virus progresses from one stage and eventually leading to acquired immune deficiency syndrome, which is AIDS. The viruses attack and destroy the body cells, especially the CD4 cells, the T cells, and the macrophages, thereby leading to a weakening of the immune system. Unfortunately, the virus is transmitted through transfer of blood, semen, breastfeeding, and vaginal discharges. Unfortunately, Nigeria has the highest burden of HIV/AIDS in West Africa and Central Africa. Though there is no cure for HIV infection, it can be managed with effective prevention, diagnosis, treatment, and care. Next slide. Statement of problem. HIV/AIDS remains a major global public health pandemic, which has infested about 130 million persons since after the inception of the epidemic in 1981. According to WHO report, in 2004, about 40.8 million were diagnosed, and 65% of these diagnoses were in sub-Saharan Africa. And based on national data from the NACA, Nigeria is living with about 2 million of this population. And out of this population, about 1.7 million are currently on the combination therapy. Next slide. Aims and objectives. The essence of this study was to ascertain the effectiveness of the antiretroviral combination therapy, HIV in patients at General Hospital Ugep and Ogoja Metropolis in Cross River State. Objective of the study was to estimate the CD4 count and the viral load. Activities of serum enzymes via AST, A18, and alkaline phosphatase. Activity of antioxidative enzymes such as superoxide demustase, catalase, and glutathione peroxidase. Concentration of serum total protein, albumin and globulin. Concentration of serum vitamin C and E. Concentration of uric acid, creatinine, and total bilirubin. Concentration of serum sodium, potassium chloride, and bicarbonate ions. Next slide. Material and method. Each of these combination therapy contain lamivudine, which is a nucleoside reverse transcriptase analog. They also contain nifuripine, which is a non-nucleoside analog, and zidovudine, which is also a nucleoside reverse transcriptase analog. The ART drug was administered twice daily for a period of 6 months. Other things were the refrigerator, water bath, sample tubes, syringe, needles, and spatulas, and deionized water. Next slide. Criteria for sample selection. A total of 200 HIV positive patients and 100 patients were used. 100 were used as normal, which were used as control. The study location was General Hospital Ogoja. From the result, it was proven that the combination therapy were very efficacious. The CD4s and the viral load were well suppressed, while there was a boost in the CD4 after the 6 months of strict adherence to the regimen. Also, some of the antioxidative enzymes were improved, and even the liver enzymes, they were improvement. Those that were HIV naive, their conditions were very critical, but upon the 6 months of the intervention, there was a significant improvement in these biomarkers. Thank you very much.
Thank you for your presentation. The next presenter is Obinasi Godfrey. He'll be presenting to us on the topic cycloglycine B drug suitability against target proteins implicated in oral leukemia, insights from DFT, pharmacokinetics, and molecular docking.
Good afternoon, everyone. My name is Dr. Obinna Chukwemeka Godfrey of the Department of Biochemistry, University of Calabar. My topic is cycloglycine B drug suitability against target proteins implicated in leukemia, insight from density functional theory, pharmacokinetics, and molecular docking. Next slide, please. All right, these are the contents of the research. Next slide. The present study explored the potentials of cycloglycine B as an anti-leukemic agent. We utilized density functional theory, molecular docking, and pharmacokinetic protocols for the investigation. Next slide. For the statement of the problem, reports have shown that leukemia prevalence is on the increase in Nigeria, and this warrants, search for new drugs to help this situation. Next slide. All right, for the aim and objectives. The aim of this work is to explore the efficacy of cycloglycine B in leukemia treatment by targeting 2 proteins involved in leukomogenesis, that is leukemia progression. So you can see the objectives there. Because of time, I wouldn't dwell so much on that. Next slide. For materials and methods, this work is purely in silico. In other words, it is computer-based. So we utilize a lot of advanced, software application packages to carry out our research. Next slide. All right, cycloglycine B was extracted from latex of Jatropha gossypifolia. This plant is widely distributed in southeastern part of the country, and it is also found in Cross River. So HPLC, which is high performance liquid chromatography, was used to analyze the structure, and we discovered that it has 8 amino acids linked together by peptide bonds in a cyclic form. Let's look at the next slide. Yes, figure 1 there is cycloglycine B I'm talking about. The figure 2 is the prepared form for computational analysis under the framework of density functional theory. I will come to that later. Then figure 3 is asciminib hydrochloride, which is an approved drug, an approved anti-leukemic drug. So we involved this drug in this work because of comparison with our compound. All right, justification for selecting cycloglycine B in this work. The justification here is that it has structural resemblance with 2 cyclopeptides, facalistatin 10 and facalistatin 11, which have been demonstrated to have anti-cancer effect. So we looked at structure-function relationship. That was why we selected that compound. Now, next slide, please. Yeah, so we selected 2 proteins involved in leukemia progression. The first protein is dysregulated. That first protein you're seeing there is dysregulated tyrosine kinase, which is responsible for the proliferation of abnormal granulocytes or abnormal white blood cells. And of course, that is the hallmark of leukemia. The second protein there is responsible for the drug resistance experienced by leukemia patients. So we interacted our ligand with these proteins in order to destroy the amino acids and, disorganize the conformation so that we will render them inactive. Next slide. Now, we optimize our compound in 3 solvents: dimethyl sulfoxide, ethanol, and water. Of course, this is very important in medicinal chemistry because you need to know the effect of your solvent on the compound, because solvents can enhance or, mar efficacy. So the balloon-like structures you are seeing there are the electron clusters. And as drug developer, you need to know where your electrons are clustered so that you can make some modifications there. And the transition of electrons from ground state to excited state creates an energy gap that tells you whether the compound is stable or reactive. If the energy gap is high, the compound is stable. If the energy gap is small, the compound is reactive. And it is this reactivity that makes it possible for the interaction within the living system to constitute, perpetuate, and it is well. All right. In conclusion, our compound had strong binding affinity against the against the proteins, and this can form a good anti-leukemia drug. Thank you, and God bless all of us.
Thank you, Doc. The next presenter, I think that should be 6. Is that the 6 persons? Okay. So the next presenter, Innocent E. Amen. Representing on effect of ethanol extract of Denisha tripetala, pepper fruit, on fear and.
Good day, moderator, distinguished ladies and gentlemen. My name is Innocent Emeng, postgraduate student, Department of Public Health. I'll be presenting on the effect of ethanol extract of Denisha tripetala, which is also known as pepper fruit, on fear and anxiety in mice. So these are my content. Background. Mental health-related illness, particularly anxiety disorder, have become a major public health concern worldwide, significantly impairing emotional well-being, social functioning, and economic productivity. Globally, anxiety disorder rank among the most common mental illnesses, affecting more than 300 million people according to the World Health Organization. This condition often manifests as excessive fear, restlessness, and difficulty coping with daily stressors, leading to decreased work efficiency and increased economic burden. In Nigeria, recent community-based studies have shown that approximately 20 to 25% of adults experience significant anxiety symptoms. Statement of the problem. The burden of anxiety disorder in Nigeria is high, yet the availability and affordability of effective treatment remains limited. These rising figures are compounded by economic hardship, unemployment, insecurity, and social stressors, which further elevate the burden of mental distress and reduce productivity. The need for accessible and affordable treatment options is therefore critical, especially in low-resource settings like Nigeria, where conventional anxiolytic medication are expensive and sometimes associated with adverse side effects. In response to this, increasing interest in natural plant products as cost-effective alternative for management of anxiety and other neuropsychiatric conditions. Denisha tripetala, which is also known as pepper fruit, a tropical plant widely consumed in Nigeria, is traditionally used to manage ailments such as cough, fever, toothache, diarrhea, diabetes, and even nausea in pregnancy. It contains diverse phytochemicals, including alkaloids, saponins, flavonoids, which have been reported to exhibit antimicrobial, analgesic, anti-inflammatory, and neuropharmacological effect. Aim and objective. The aim is to determine the effect of ethanol extract of Dinescia trapetella in fear and anxiety in mice. The objectives include to observe fear and anxiety in the control group, to observe fear and anxiety in the untreated group with memory impairment, and to observe the fear and anxiety in test group treated with Dinescia trapetella. My materials and method. Materials, those were the materials that were used for this study. Preparation of Dinescia trapetella. Dinescia trapetella fruit were purchased, identified, and authenticated at the University of Calabar Herbarium. The seeds were dried, pulverized, and 200 grams of the powder was extracted by cold maceration in 95% ethanol for 24 hours. The extract was filtered, concentrated using a rotary evaporator at 45 degrees Celsius and stored at 4 degrees Celsius. A working solution was prepared by dissolving 15 grams of the extract in 150 ml of normal saline. 18 mice were housed under standard laboratory conditions and allowed to acclimatize for 2 weeks. Food and water were provided to them at libitum. Ethical approval was obtained. That's the ethical approval number on the screen. Experimental design. 22 to 31 grams of mice were randomly assigned into 3 groups with 6 mice per group. Group A served as the control, Group B served as the ethanol group, and Group 3, or Group C, I beg your pardon, served as the treatment group. Anxiety-related behaviors were assessed using the elevated plus maze. Each mouse was placed in the center, facing an open arm, and allowed to explore for 5 minutes. The maze was cleaned with methylated spirit between trials. Behavioral scores were obtained for open and closed arm entry, duration, head dip, stretch, attend posture, rearing, grooming, urination, and defecation. Statistical analysis was done using ANOVA, followed by least significant difference post-hoc test. Results were analyzed as mean plus or minus standard error of mean, and statistical difference was set at p-value of 0.05. Data analysis was performed using IBM SPSS statistics. So just run through the result to my conclusion. Okay, discussion. The study assessed the effect of ethanol extract of Dinescia trapetella on fear and anxiety in mice using the elevated plus maze. Ethanol administration increased anxiety-like behavior by increasing head dips, stretch, attend posture, grooming, close arm entry frequency, and close arm duration, while open arm duration and open arm entry was decreased. Conclusion. The finding of this study demonstrates that ethanol extract of Dinescia trapetella significantly reduces anxiety-like behavior in mice, as evidenced by improved open arm exploration and reduced fear anxiety responses in the elevated plus maze. These results indicate that Dinescia trapetella possess notable anxiolytic properties and may modulate neural pathways that are involved in anxiety regulation. Thank you very much.
Okay, can we? This session, we will now go to the question session. For each one of them, we'd like to ask 2 questions. So I hope you wrote down your questions. You need to come up to ask. Tell us mention who you are directing your question to, and you please write down your questions. So 2 questions for each presenter. Time starts now.
Question to the last presenter, please. Please, with your aim and objectives, I discovered that you have, one of the objectives is to assess learning and memory. But you have it there. One of your objectives is to assess learning and memory. But you have not been able to tell us how to achieve that with elevated plus maze. And I am believing that we cannot assess learning and memory with elevated plus maze. You have not mentioned the the tool or the equipment or apparatus you will use to assess learning and memory. And number two, your citations, you have to go through them. You are using sign X for an. You should correct it to normal an. Are you there? A-N-D. An. You should correct that. And some of your etals, whether it's mistake or what, you've not been able to utilize them. You should do so. But I am concerned with that their objective number 2. Thank you.
Thank you very much, our presenters, for a job well done. My question goes to the first presenter. My name is Dr. Obajakpe, Department of Community Medicine. The first presenter, your objectives. If we are presenting, if you are doing a research, your objective is supposed to be smart and X there to be specific. Your objectives were double barrel. And I don't know how you can achieve that. So you have to work on them. And then when you said ethical clearance, you just mentioned ethical clearance, but you never mentioned where it was gotten. Please, research now. You must have ethical clearance from the approved body. Otherwise, it will not be published. I'm sure you were here in the morning to hear that even some publishers will ask for the number. This number, you don't copy it anyhow. We have approved ethical bodies from the Ministry of Health. If you want your articles to be published, please get it at the right place. Then for the fourth speaker or a fourth presenter, although you didn't finish, but you just ended like that without even telling us your result or your conclusion. And when you are presenting, you should at least have a way of telling us recommendation. You don't just present and conclude without recommendation. There should, even if it's one sentence. Thank you very much and well done.
Thank you very much for your presentation. My question goes to the young man that presented on hemoglobinopathy. I think that should be the fourth presenter. I did hear that the study method, the study design rather, you used was a retrospective study design or review. Please, can you throw more light on how you carry out that retrospective review? Please, I would want to know how you did it. Thank you.
Any more questions? Otherwise, we allow them to react to the questions. Can you go ahead to react to those questions?
Okay, thank you very much, Dr. Uket, for your observation. Well, my study was not really focused on memory and learning, I beg your pardon. But then the areas that are implicated in learning and memory are the same areas that are implicated for anxiety disorder. So those centers include amygdala, hypothalamus, hippocampus, and even the nucleus of stria terminalis. So by inducing memory and learning disorder, you have as well induced anxiety disorder. So we had to compare the anxiety behavior in the memory impaired group to the control to ascertain whether there was learning disorder in the inertial trabecular group. Thank you very much.
Since you are the one who presented inducing fear and anxiety on rats, what do you really aim to get from this study? Why?
Okay, currently mental health disorder is something of great concern. I gave the statistics of people living with mental illnesses. And anxiety is one of the leading cause of mental illnesses, where majority of the population are suffering from anxiety-related disorder. So that was the basis for me to ascertain whether a plant product, just like Dinecia trapetella, can really affect or treat anxiety disorder. Thank you very much, sir.
Please, as a way of guiding you, memory cannot be accessed through fear and anxiety, because there are parameters we use to assess whether learning has taken place before we start thinking of the memory. You cannot use that. We know that the brain centers that are implicated in fear and anxieties are like 20%. The main components that are responsible for learning and memory. When you are looking at fear and anxiety, you are looking only at the locus of what? The subcortical regions. You have no touch with the higher cortical centers, whereas memory has to do with higher cortical centers, where you should consider if the learning was there before the memory first, before the memory could come, because you must learn first before you retrieve memory. You have not been able to assess that. And to do that, you were supposed to return to a tool, an apparatus like the Morris water maze that enables you to see if the animals were able to learn and they will retrieve by short-term or long-term memory. If you cannot use that, you can go to recognition memory, novel object recognition memory, which are the closest. For you to go to the extent you are going, so you would have done histology. Do you understand?
Yes, sir.
So you have to remove, if you must publish that paper, go to your paper and expunge memory as part of your objective there, because there is no explanation anywhere in your paper that is bringing memory in. Thank you.
Thank you, sir. Duly noted.
Thank you, Doctor, for the observations. First and foremost, you said my objective should be smart, that it was double barrel. So I think you mean you wanted the objective to be, I don't understand, in a point. Okay, my objective number 1 said to determine the prevalence of hand contamination with bacterial organism among the study subjects. Okay, then the second I said to assess the knowledge and level of hand hygiene practice among the subjects. Sir. The hands, yes, sir. And level of hand hygiene practice among the subjects. Okay, ma. So that means it should be objective number 3, ma. All right, ma. Then, for my ethical clearance, sir, I actually sought for approval from Health Research Ethics Committee in UCTH, because I said initially that I did the work in a secondary school. So the secondary school was within the jurisprudence of University of Calabar, specifically. Okay. Okay, I wasn't supposed to take it from UCTH. Okay. It's okay. Yes. Because that's what my supervisor actually advised. No. Okay, sir. Yes, I was. And I was giving number to that. But please check slide 7, sir. Yes, Prof. Yes, it was written there, Unica International Demonstration Secondary School. That's what I said. Yes. Yes.
Sorry. Quick. What did you? Then number 2, you said your sample size was about 300 and something. Looking for that is either you are using half so that you can relate it, or you are using quota, not just take any number. In this thing, you should say, okay, this is the total sample size, but due to funds or whatever, we go for half, or so that you can relate the results.
Yes, I noted it, though I said initially that it was because of fund we reduced it, but we are still going back to check for prevalence that will fit in within our range before we publish it, sir.
Okay. Thank you very much. I am Orok Daniel Achibong. I teach in College of Health Technology. So based on the question that was asked on hemoglobinopathies, so what is that when students are admitted in our school, that's College of Health Technology, they are made to undergo medical examination tests, in which genotype is one of the tests we carry out for all the newly admitted students. And this, so my work was a kind of a review from this genotype test from 2020 to 2022. So after reviewing, analyzing this data, so that was when I was able to come out with the result of the pattern of hemoglobinopathies among the first year students in College of Health Technology. So that was why it was a retrospective study design. Thank you. Yeah, they come to our diagnostic lab. So we collected their samples and carried out a genotype test as well as blood group test. So it was from the record in the laboratory that I was able to retrieve the data to carry out my analysis. Yes, yes. Yes, I mentioned it in my research during my presentation, yes.
I was just wondering whether you had references at all, because nothing was presented.
Okay, I think why I didn't include my references, it was from the template they gave to, they sent to us. So the template did not carry references. So I think that was why I didn't include. I actually have references.
No, we gave time for questions. At that time lapsed because we are going on to the next 6 presentations. Huh? Next time we call for questions, please make sure you come up with the questions.
You know, that is always a reference point. My name is Dr. Eze. My brother, my problem is the use of the word pattern when you only looked at 2021 and 2022? The 2 years, are they enough for you to have a generalized pattern? I don't know whether you understand what I'm talking about. Just 2 years. Is that enough to have a pattern?
It was actually 3 years, not 2 years. 20,
Even at 3 years, I don't think 3 years are enough for you to assert that this is the pattern of hemoglobinopathies in that place. I don't think 3 years are enough. Because when you use the word pattern, unless you said pattern within 2021 to 2023.
The essence of asking questions and making comments is to also help the presenters. If you said they should not use pattern, what do you suggest they should use? Yeah, because even though the period is short, that is 3 years, what he is saying, he wants to know the pattern of hemoglobinopathies within those 3 years. So it's even within 1 year, you can know what happens. Whether people are all HBs, AA, AS, SS. Those are all patterns. Beautiful. You should add that so that it's not as if it's open. Thank you. I think we still have one more person to ask to react to. Any other person who was okay? Assessment. All right. Can we give them a round of applause as they come down? Thank you very much. Very nice presentations. So we go on to the next 6 presentations. I hope the presenters are all around. So, and the very first in that round will be taken by Professor.
Okay, first presenter, Helena Nko, presenting on, is she around? Okay. She'll be speaking on abundance of malaria vector. Is she the one? No. Okay. Come on. Okay, so. Okay, sorry. Okoy Clement. Okoy Clement. Modulatory effect of ethanol root extract of Lepidium on liver enzymes. Okay, modulatory effect of ethanol root extract of Lepidium minor on liver enzymes and some hematological indices.
Well, Okoye, let's remind you that you need to tell us whether you are undergraduate, graduate, or staff, and then know that the time is 5 minutes. 4 minutes you will be warned, and 1 minute added, you have to stop. Thank you.
Good afternoon, distinguished medical researchers. My name is Okoy Clement from the Department of Physiology. I will be presenting on the topic, modulatory effects of ethanol root extract of Lepidium. Okay, I'm an assistant lecturer, Department of Physiology. So I will be presenting on the topic, modulatory effect of ethanol root extract of Lepidium mayeni on some hematological indices and liver enzymes in doxorubicin-induced hepatotoxicity in Wistar rats. Okay, so these are my table of contents. Okay, so the background of study. Doxorubicin is a chemotherapeutic agent that has been used for the treatment of cancer, although it's very efficient, but it causes damage to vital organs in the body, organs like the heart, the liver, and the kidneys. Now, it causes adverse effects like cardiotoxicity, hepatotoxicity, nephrotoxicity. Next slide, please. Okay, so the maca plant have been known for its nutritional and medicinal uses. It belongs to the family Brassicaceae, and then it's known to possess high levels of carbohydrate followed by proteins and lipids. Next slide, please. Now, cancer, which is second to cardiovascular disease, causes mortality, and then it's reported that about 19.3 million people are diagnosed annually with cancer. So, doxorubicin, a chemotherapy drug, causes injury to the liver, which may be life-threatening. So, despite current efforts to mitigate this adverse effect caused by doxorubicin treatment, existing strategies are inadequate, underscoring the need for innovative solutions. Next slide, please. So this is the aim of the study, to evaluate the modulatory effects of ethanol root extract on liver enzymes and some hematological indices in doxorubicin-induced hepatotoxicity. The objectives: one, we look at the phytochemical constituent of Lipidium mayeni root extract. We look at the effects on liver enzymes, AST, ALT, and ALP, and also its effects on hematological indices. Next slide, please. Okay, so ethical approval was obtained from the Ethics Committee of the Faculty of Basic Medical Sciences, and an approval number was given, as stated there. The plant was obtained from JOST and was authenticated by a botanist from the Department of Botany, University of Calabar, and a voucher number was also given. So the plant extraction was done by maceration, as reported by Abubakar and Hagnet 2022. A preliminary analysis was done. Phytochemical analysis was done. The acute toxicity was also determined according to the method of LOX method, reported by Energy 2013. So 25 male Wistar rats were used for this study, and then they were grouped into 5, consisting of 5 rats each. Yeah, the treatment lasted for 14 days, and after then, the animals were anesthetized, blood samples were collected for liver enzymes and hematological analysis. Next slide, please. So this shows the research design, where you have the group 1. The group 1 was given 10% of normal saline orally, and group 2, which is the negative control, was induced with doxorubicin intraperitoneally. So this was done 3 times in a week for 2 weeks to have a cumulated dosage of 50 milligrams per kg. The group 3 was induced but treated with low dose of the extract. Group 4 was also induced, treated with high dose of the extract, and a standard drug was used in the group 5 group to treat the condition. Next slide, please. Okay, so from the result, it shows that doxorubicin causes an increase in liver enzymes. It also causes a reduction in hemoglobin, causes a reduction in hematological parameters. So doxorubicin administration causes a significant decrease in all of these, and then there were some phytochemical constituents that has had an ameliorative effect caused by doxorubicin administration. Thank you.
let presenters be more time conscious. When you get there, don't give too much details. Just a little of your statements of problem, objectives, and then go to your methodology and then results. Well done, first presenter. Okay, so we take Enosakare Asemota on hemorrhagical variables among printing press workers in Calabar metropolis, Nigeria.
Good afternoon, everybody. I am Dr. Enosakare Ayudibia, Department of Hematology and Blood Transfusion Science, Faculty of Medical Laboratory Science, University of Calabar. I'll be presenting on hemorrhagical variables among... Yes. Okay, I'm a staff of the Department of Hematology and Blood Transfusion Science. Dr. Samota is my name. So I'll be presenting on the hemorrhagical variables among printing press workers in Calabar Metropolis, Cross River State. This is my outline. And as a way of introduction, printing press workers are routinely exposed to a complex mixture of airborne particles, volatile organic compounds, and very heavy metals from ink solvents and printing processes. If any of us had the opportunity to go into the places where they do this printing, at times it's very uncomfortable because of the chemicals that are being made use of there. Hemorrhagy is the study of blood flow properties, including whole blood viscosity, plasma viscosity, electrocyte deformability, and electrocyte aggregation. It's a sensitive index of the hemodynamics and inflammatory state of an individual and can be modified by environmental and occupational sensors. Statement of the problem. Printing press workers in Calabar Metropolis are frequently exposed to ink solvents, particle emission, and other chemical agents that may induce systemic inflammation, oxidative stress, and alteration in blood rheology. Therefore, findings from this study will inform evidence-based workplace controls, health screening strategies, and policies aimed at the printing press workers in Calabar Metropolis and similar settings. The aim is to provide valuable information on hemorrhagical variables among printing press workers in Calabar. The objective to determine these hemorrhagic variables among printing press workers and non-printing press workers, to determine if duration of exposure affects hemorrhagical variables, and also if years of exposure and age also affect these parameters. Materials and method. This was a cross-sectional case control design. The study was conducted at various printing press in Calabar Metropolis, and then a total of 100 subjects aged 18 to 50 years were enrolled for this study, 50 printing press workers and 50 apparently healthy individuals as controls. The four main tests or parameters that were assayed were relative plasma viscosity, PCV, packed cell volume, erythrocyte sedimentation rate, and fibrinogen. The demographic parameters actually showed that we had males, majorly males, that were in the printing presses, and 12% from the whole group were using PPEs. Okay? This table actually shows us the relative plasma viscosity, PCV, ESR, and fibrinogen of printing press workers. The next table, please, table 2. Table 2. From this, we saw that the relative plasma viscosity and the ESR of printing press workers were high. This clearly states that there are inflammatory responses as a result of exposure to these chemicals within these persons. And this could lead to serious cardiovascular problems. All right? The next table actually shows the parameters based on working hours. There was no significance. And then also based on the years of exposure, there was also no significance in these parameters within the group. H2 did not show any significance. In conclusion, printing press workers in Calabar experienced significant hemorrhagical alterations, particularly increased plasma viscosity and erythrocyte sedimentation rate, which indicates exposure-driven inflammatory processes. Although PCV and fibrinogen remained within acceptable ranges, the observed changes suggest early-stage disturbances that could escalate into more serious cardiovascular complications with continued exposure. It's therefore recommended that comprehensive occupational health interventions be made, ranging from improved safety compliance to mandatory health monitoring, which are warranted to prevent long-term adverse outcomes. Thank you very much.
Thank you for keeping to time.
Thank you for the exciting presentations. The next one is going to be even much more exciting, and I'm fascinated by it. I hope the presenter is here. He must tell us. And the title is Evaluation of Nutrients and Anti-Nutrients Composition of Snuff. And this is to be done by no other person than Offiong Abasiama Oscar. Snuff.
Good afternoon, distinguished ladies and gentlemen. My name is Abasiama Oscar Ofong. I'm master's student of Nutrition and Food Science, Department of Biochemistry, Faculty of Basic Medical Sciences, University of Calabar. I'll be speaking on the topic, Evaluation of Nutrient and Anti-Nutrient Composition of Snuff, Nicotiana tabacum. Next slide, please. These are my table of contents. Then the introduction. Just like Prof said, it's a very interesting topic, especially as regards to nutrition. You might be wondering, why are we talking about snuff? Now, it is evidence that the use of tobacco has reached high epidemic proportions and is a major global health challenge. It's also a major health risk for most leading causes of death worldwide. Tobacco use is a leading threat to global economy, causing loss of productivity, pain, grief, and misery. Now, I would like you to know that snuff is one of the oldest use of tobacco. Till date, many claim that they consume it because of its stimulating nicotine boost. You know, it gives them that kick. And they believe that it relieves conditions like cold and stops snoring. But the truth is, it is harmful to health, which we will see from the study. Next slide. Over the last decades, snuff has continued to be consumed, especially in the rural settings. It might interest you to know that even till date, snuff makes its way to the marriage list. You know, when they give the list for the bride price, snuff is usually there. There are many opinions on snuff. To some it is medicinal, to others it is harmful. Yet, the death toll from tobacco is estimated to reach over 8 million deaths per year by 2030. And if left unchecked, tobacco could kill over 1 billion people in the 21st century. Sadly, the consumption of snuff is very addictive, and consumers are ignorant of its adverse health effects, as basic data about the nutritional and anti-nutritional composition is lacking. My aim and objective. The purpose of this study is to analyze the nutritional and anti-nutritional content of snuff. Next slide. These are my materials and methods. Let's go to the results. From the results, this is the phytochemical screening. We see that alkaloids are in high concentration, flavonoids in high concentration, tannins, moderate concentration, glycosides, phenol, low concentration, and reducing sugar, moderate concentration. Next slide. This is the proximate composition of snuff. You can see that carbohydrates is in high concentration. We just pick the next slide. Next slide, mineral composition. Seeing there on the screen, you see that cadmium, I was really interested in this. Cadmium is in high concentration. Then the next slide, we have the chart for phytochemical composition. You see the alkaloids and flavonoids there. Now, discussion. The question is switching to snuff a better health alternative for the cigarette smoker? Probably only in terms of avoiding the negative health effects associated with the tobacco combustion on the cardiopulmonary system. But the most important pathological mechanism, which is that of nicotine dependency and abuse, remains. Unlike cigarettes, snuff contains harmful and addictive chemicals that can raise the risk of many health problems. Like the flavonoids found in high concentration in snuff, Chilean minerals like iron and zinc, they reduce their absorption. Alkaloids found in snuff act on the nervous system, disrupting or inappropriately augmenting electrochemical transmission, leading to rapid heartbeat paralysis and even death. Tannins are also known to reduce the bioavailability of nutrients in the gut, especially protein. Cadmium, found in high concentration, can cause the transformation of normal epithelial cells into carcinogenic cells by inhibiting the biosynthesis of protein. Now, in conclusion, even if using smokeless tobacco, which is snuff, might help some people quit smoking, it can cause cancer and other health problems. So it is not a safe alternative. And because it contains nicotine, it is equally addictive and hard to quit. Unlike other forms of tobacco, snuff contains cancer-causing chemicals. It can raise the risk of other types of cancers, as stated. The use of snuff in the society, especially in rural settings, should be discouraged as it is harmful. Further research on snuff is highly recommended. Thank you.
A round of applause for her. I want to make a comment. The timing is 5 minutes. You are one after 4, and you are given 1 more minute to round up. Now, these presentations are being assessed. And if you don't, part of the assessment is your timing. So if you are not obeying the timing we have set out, it can as well be a minus for you. So if we are telling you that you have to do 5 minutes, time yourself to that 5 minutes. We listen to the next presentation.
By Tolani Adeboye. Is he in the house? Avocado and watermelon dietary fruits regimen as a protective strategy against BPA-induced thyroid and behavioral disorders.
Good evening, colleagues and fellow researchers. My name is Tolani Adeboye from the Department of Physiology, postgraduate students, University of Calabar. I'll be presenting on avocado and watermelon dietary fruit regimen as a protective strategy against bisphenol A-induced thyroid and behavioral disorders. Next slide, please. This is my content slide. Metabolic dysregulation increasingly correlates with thyroid dysfunctions, anxiety, and other neurobehavioral issues. Bisphenol A is a colorless substance and is a pervasive endocrine disruptor that is commonly used in the production of plastics, thermal-receipts, resin, and food packaging. So bisphenol A is an endocrine disruptor that we consume on a daily basis because they use it in producing water bottles and everything made of plastics. There is a daily tolerable dose, which is 0.2 nanogram per kilogram body weight per kg per day. But then, because we take it in larger quantities, it is of great concern. Nutritional interventions using bioactive rich fruits like avocado and watermelon may counter this effect because they contain antioxidants. Avocado is very rich in monounsaturated fatty acid and has been known to modulate neurobehavior. Likewise, watermelon